Entirely determine the patient's height and weight and vital signs which are within the normal limits for her age, height, and weight, and age in 21. She is alert and oriented. Her speech is clear, audible, and articulate. She is dressed appropriately for the weather. Her skin is consistent with her genetic background, and her gait was steady and balanced as she approached. So now we'll begin her head-to-toe assessment. Hello, my name is Tori. I'll be your student nurse today. Can I have your name and date of birth, please?
Okay, Lisa Dowden, August 25th, 1993.
Okay, thank you, Ms. Dowden. Today I'll be performing your head-to-toe assessment, which will take about 30 minutes. Do you have any questions?
None.
Okay, I'm going to give you some privacy real quick. Okay, good. Your head is normal cephalic, midline on your body. There's no tics or droopings noted. Your facial expression is calm and relaxed for the situation and appropriate. So now I'm going to palpate your head. I do not note any lumps, abrasions, or lesions noted. Scalp is healthy. There are no foreign objects or particles present. Okay, now I'm going to palpate your sinuses. This is your frontal. And for your maxillary, did you have any pain?
No.
Okay, no pain noted or inflammation. Okay, now I'm going to go ahead and have you smile, frown, puff out your cheeks, raise your eyebrows. Okay, good. Cranial nerve 7 is intact. Can I have you resist your jaw against my pressure? Okay, good. Cranial nerve 5 is intact. Now I'm going to have you close your eyes for me and just let me know every time you feel the cotton ball.
Yes, 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 yes.
Okay, good. Cranial nerve 5 is intact. Can I have you say light, tight, dynamite?
Light, tight, dynamite.
Okay, good. Cranial nerve 12 is intact. Now I'm going to go ahead and palpate your TMJ, so just open and close your jaw for me. And left and right. Okay, good. Now popping your crepitation noted, full range of motion, grade 5. Alrighty. Your eyes are symmetric and equal in size bilaterally. Your eyelashes and eyebrows have equal hair distribution. There is no drainage noted. Now I'm going to palpate your lacrimal duct. There is no drainage. Did you have any pain? Okay, good. No pain noted. Can I have you look up for me? Okay, conjunctiva is pink and moist. Sclera is trying to white. Alrighty, now I'm going to have you do a confrontation test. So just cover one eye for me and just let me know every time you see my finger.
Yes. 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 Yes.
Okay, good. Now the other eye.
Yes. 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 Yes.
Okay, good. Thank you. Cranial nerve 2 is intact, and you have good visual fields. Your peripheral vision moves within normal limits, so that's good. Alrighty, now I'm going to do the Snellen test. So I'm just going to have you read the smallest line, read the smallest line possible for me. I'm going to cover one eye.
All right. 374258.
Okay, and now the other eye, please.
374258.
Okay, good. So with that being said, cranial nerve 2 is intact, and you have 20/30 vision. So what that means is you see at 20 feet what the normal person sees at 30 feet. Okay. Now I'm going to go ahead and perform the corneal light reflex. So just go ahead and stare at my nose for me, please. Okay, good. The light did reflect off the same spot in each eye, which is what we're looking for. So that's good. There's no, and your pupils were still there. Okay, good. Now I'm going to go ahead and do the 6-position diagnostic test. So just follow your eyes with my pen only. Or don't move your head or your neck. Okay, good. Eye movement was parallel, which is what we're looking for. So with this test and the previous test, cranial nerves 3, 4, and 6 are intact. Okay, now I'm going to do a pupillary light reflex test. So just stare straight ahead of the walkway. I'm going to come in at a 15-degree angle. Okay. So pupils did constrict in each eye symmetrically in reaction to the light, so that is good. And now I'm going to do accommodations. I'm going to just have you stare at my nose for me, please. And when I bring my pen into focus, just focus in on that. Okay, good. Your pupils did constrict symmetrically and equally, and in response to accommodating to the pen light, which is good. There was no deviation noted there. So with this test and the previous test, cranial nerves 2 and 3 are intact. And now I'm just going to do a quick cover test. So I'm just checking for any deviations. Okay, got a steady fixed gaze, so that's good. No deviations, no. Alrighty, and with now I'm going to go ahead and inspect your internal structures. Okay, so I'm going to come in at a 15-degree angle. Red reflex is present. Optic disc is creamy yellow. Retinal arteries and vessels are present. Okay, now the other eye. Okay, red reflex is present. Optic disc is creamy yellow, and retinal arteries and vessels are present. Right, and with that being said, I did notice that your pupils are round, equal, and reacted to light and accommodation, so that's good. Alrighty, now I'm going to move on. Your ears are symmetric, equal in size bilaterally. There is no training, lumps, abrasions, lesions noted there. I'm going to go ahead and palpate your auricle, checking for pain. Okay, now your tragus and your mastoid process. Did you feel anything?
No.
Okay, good. That's good, no pain noted there. Alrighty, now I'm going to perform a whisper test, and a couple hearing tests, so just cover one ear for me and repeat whatever you hear.
ABC.
Okay, good. Now the other ear.
1, 2, 3.
Okay, good. Cranial nerve 8 is intact. Alrighty, now I'm going to perform the Weber test. So I'm going to strike the tuning fork and just place it in the center of your head. So just let me know when you can't hear it.
Okay.
Alrighty, and were you able to hear equally in both ears?
Yes.
Okay, so I know the patient is able to hear equally in both ears. Alright, now I'm going to do the ringing test. So I'm just going to place on your mastoid process, and when you tell me you can't hear it, I'll place it in front of your ear.
Okay. Okay.
Alright. The other side.
Okay.
Okay, so cranial nerve 8 is intact again, and what I got from that is that you're able to hear air conduction more than bone conduction, which is good and what we were looking for. And also with the Weber test, cranial nerve 8 was also intact. Okay, now I'm going to go ahead and inspect your structures. So I'm going to pull your ear up and just go in. There is no excess drainage in the external canal. Tympanic membrane is pearly gray. No retraction or bulging noted. Umbo is present. The short process of malleus and the maneuvering of the malleus is noted. And the conal white is present in the 5 o'clock position. So I'm going to move on to the other ear. Oops. Change out my speculum. Okay. All right. Okay, there is no excessive drainage in the external canal. Tympanic membrane is pearly gray. No bulging or retraction noted. Short process of malleus is present. The umbo is present, and the maneuvering of the malleus is present. Conal light is in the 5 o'clock position, or the 7 o'clock position. Excuse me. Alrighty. Okay, good. Now I'm going to keep going, and your nose is symmetric, equal in size bilaterally. There are no lumps, abrasions, lesions noted, so that's good. Can I have you look up for me? Oops. Okay, nasal mucosa or mucous membranes are red and moist. Turbinates are intact. There's no nasal septum deviation in the right snare. And now, again, turbinates intact. No mucous membranes are present, or the nasal mucosa is red and moist. And there is no drainage or nasal septum deviation over here. The drainage, bleeding information is falling, which is good. Okay, now I'm going to go ahead and have you, include one nostril for me. Close your eyes and just let me know what you smell. Oh. Alcohol. Okay, other side.
Alcohol.
Okay, good. Cranial nerve 1 is intact. Alrighty. Now I'm gonna go ahead. Your lips are symmetric, equal in size equal in size. There is no cracks, lumps, abrasions, which are noted there, so that's good. Before we move on to your oral mucosa, I'm gonna fill some gloves. Okay, good. Have you open your mouth for me? Okay, good. Buccal mucosa is pink and moist, hard and soft palate, pink and moist. Uvula is midline, pink and moist. Posterior pharynx is pink and moist. Anterior and posterior pillars are pink and moist and present intact. Tonsils present 2+. I'm able to see the sentence duct. Can you lift your tongue up for me? Okay, tongue and frenulum are midline, pink and moist. I can see the Wharton's duct. I don't see any dental caries. All teeth are present except wisdom teeth, which are absent. Permanent teeth are in. Can you say ah for me? Ah. Okay, good. Soft palate and uvula rose at the same time, so cranial nerve 10 is intact. Okay, can I test your gag reflex real quick? Alright, so just, okay, good. The gag reflex was present and the voice was smooth and soft, so cranial nerve 9 is intact. Looks like you have pretty good oral hygiene. So I would say just keep brushing and flossing daily. So that's good. Alrighty, now I'm gonna have you close your eyes for me and just stick out your tongue and let me know whatever you taste. Sugar. Okay, good. Cranial nerve 7 is intact. Okay, now I can keep going, and I would say your trachea is midline. Can you look up for me? Okay, good. There's no inflammation. Swelling. Do you have any pain?
No.
Okay, noted. Okay, I'm gonna go ahead and palpate your thyroid. Just gonna have you lean forward for me, please, and lean to the right and swallow, and to the left and swallow. Okay, good. Did you have any pain with that? No? Okay, good. I did not feel any inflammation or bulging notice, so that's good. Okay, now I'm going to identify your lymph nodes, starting with your preauricular, posterior auricular, occipital, submental, submandibular, tonsillar, superficial cervical, deep cervical chain, posterior cervical, and supraclavicular. Okay. Did you have any pain with that?
No.
Okay, good on you. No pain or enlarged lymph nodes, which is good. So now I'm going to go ahead and check out your trapezium and your sternomastoid, which are equal in size and symmetric, so that's good. Did you have any pain? No? Okay, good. Alrighty. Now I'm going to go ahead and check your skin. So, thank you. Skin is tan, consistent with genetic background, even in pigmentation. It is warm to touch bilaterally, and I'm going to just check your skin texture. Okay, good. Skin retracted back pretty quickly. So I would say that you have good elasticity skin texture, and you're pretty hydrated, so keep drinking water, which is good. Okay, now I'm going to move on and listen to some I'm going to inspect your thorax. Your thorax is symmetric, elliptical in shape. I don't see any noticeable lumps, abrasions, lesions noted. I'm going to go ahead and just palpate that real quick. Okay, good. Can I have you just turn a little bit this way? Turn that way for me, please. Okay. I'm going to do tactile phimosis. So when I place my hands on you, just say 99 for me, please.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, good. I did feel strong vibrations throughout in each position equally, so that's what we're looking for. And while I'm back here, I'm going to go ahead and just percuss. I'm just checking for any resonance, so you can just place it. Okay. Okay, good. Thank you. There was clear hollow sounds as far as resonance goes, which is a normal finding, so that's good. Any pain with that?
No.
Okay, good. Now I'm gonna go ahead and real quick, I'm gonna go ahead and check your carotid. So 2 plus, 2 plus. Okay, now I'm gonna also take those real quick. Okay. Just keep inhaling for me. Okay, well, no bruise noted there. Okay, good. No bruise noted there. So now I'm gonna go ahead and listen to some heart sounds. So I'm gonna start with your aortic at the right sternal border, second intercostal space. Excuse me. Okay. Now the pulmonic at the left sternal border, second intercostal space. Okay. And excuse me. And now your tricuspid at the fourth intercostal space, left sternal border. And now for your mitral at the fifth intercostal space, left midclavicular. Okay. And I did not hear any heart murmurs or appendicitis lung sounds. S1 was heard loudest at the apex and S2 was heard loudest at the base, so that's good. Now I'm going to go ahead and listen to some lung sounds. So I'm going to go ahead and do your bronchioles. Okay, and those were loud in amplitude and high in pitch. Now for your bronchiovesicular, along your sternal border. Okay, good. And those are moderate in amplitude, moderate in pitch. And now I'm going to go ahead and do your vesicular. Okay, good. And those were low and soft in amplitude and pitch. All right, now posteriorly. So can I get you to turn again? Okay. Okay. And now for your bronchial vesicular along your vertebral column. Okay, good. And again, those are moderate in amplitude and moderate in pitch. And now for your vesicular. Okay, good. So in your vesicular, again, they were low and soft in amplitude and pitch, so that's good. I did not hear any extra lung sounds or any bruise throughout, so that's good. Okay, so now I'm going to go ahead and check your pulses real quick. So I'm going to go ahead and do your brachial, 2 plus, 2 plus. Now your radial, 2 plus, 2 plus. Okay, dorsalis pedis, 2 plus, 2 plus, and posterior tibialis, 2 plus, 2 plus. Okay, then I'm going to go ahead and check your capillary refill switches. Okay, good. Coloration returned within 2 seconds, which is normal finding, so that's good. And again, all your pulses were 2 plus, which is also good. Okay. Now I'm going to go ahead and have you lay down for me. Okay, I'm just going to inspect your abdomen, so if you can just raise your shirt a little bit. Okay, good. Thank you. All right, I know that the umbilicus is inverted. The midline to the body. I don't see any lumps, masses, lesions, abrasions, so that's good. I'm going to go ahead and also take some vowel sounds. Okay. Symbolical. Starting in the right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. Okay, and you had normal active vowel sounds. I was able to hear in there, so that's good. Now I'm gonna listen to your I'm gonna also take your arteries, abdominal arteries. Starting with your left. Okay, and your right renal, your left renal, or your iliac, I'm sorry, your left iliac, and your right iliac. Okay, I did not know any bruits there, so that's good. Now I'm going to go ahead and percuss. So again, in the right lower, right upper quadrant, left upper quadrant, and the left lower quadrant. Okay. Was there any pain? Okay, no pain. There was general tympany throughout. There was dullness on the liver and the spleen, which is a normal finding. Now I'm going to go ahead and do a superficial palpation. Again, starting in the right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. Okay, and I'm going to go in the same pattern, and now I'm doing the deep one. So I'm going to go in about 3 centimeters, and again, I'm just checking for any enlarged or displaced organs. Okay, good. Did you have any pain? Okay, good. No pain noted. No enlarged organs or displaced. All right, I'm going to go ahead and palpate your liver for me. So just inhale, deep breath. Okay, exhale. Okay, good. Your liver was smooth. I was able to palpate. The edges were smooth, so that's good. Now I'm going to do your spleen. Okay, again, big inhale. Okay, exhale. I was not able to palpate your spleen, but that's all right. That is also a normal finding. So, okay, that's good. Have you sit up? Thank you. Okay, and while I have you up in this position, I'm going to go ahead and do your costovertebral angle. So just turn for me. Okay, you should feel pressure, but no pain. Okay, did you have any pain?
No.
Okay, good. Now tenderness, no pain. Alrighty, now I'm going to test your muscle strength real quick. So can you just put your arms up like this? Is this my pressure? Okay, here your legs. Okay, good. You have equal bilateral muscle strength in your upper and lower extremities, which is good and what we were looking for. Alrighty, now I'm going to have you stand up for me. And we're going to do some range of motion tests, okay? There you go. So, can I have you tilt your head, or touch your chin to your chest for flexion, and look to the ceiling for extension, and touch your right ear to your right shoulder for right lateral bend, left ear to your left shoulder for left lateral bend. Alright, good. Now I'm going to do your spine, so can I have you touch your toes? Alright, and return to the normal position. Okay, good. I'm going to have you lean to the right for right lateral bend, and lean to the left for left lateral bend. Alright, good. Now I'm going to go ahead and move on to your arms. So, okay, can I have you reach to the sky for abduction? Oops, let me come back behind you a little bit. Okay, reach to the ground for adduction, and we're going to do big circle other way for circumduction. Thank you. Okay, and then I'm going to have you flex for me, make a muscle. Okay, and relax for extension. Okay, and then I'm going to have you start with your palm up like this, and we're going to pronate, and then we're going to supinate. Okay, good. Now this side, I'm going to have you reach for the sky for abduction and release for adduction. Then we're going to do a big circle for circumduction. Okay, that's good. And then I'm going to have you make a muscle. Oops, I'm sorry. You relax again. Okay, make a muscle for flexion and relax for extension. That's good. Okay, and then I'm going to have you pronate, and I'm going to have you supinate. Okay, good. And just real quick, I'm going to go back and do flexion again for me. So go ahead and make a muscle for flexion and relax for extension. Okay, and then again, can you just pronate your hand and supinate your hand? Okay, good. Alrighty, now I'm going to go ahead and move down to your legs. So can I just have you elevate your leg for flexion, relax for extension. Okay, good. Other side, raise your leg for flexion, relax for extension. Okay. Now I'm going to have you press on the gas pedal for dorsiflexion, or for plantar flexion, release for dorsiflexion. And then we're going to invert the toe and evert the toe. Okay, good. Alrighty, and the same thing on this side. I'm going to have you step on the gas pedal for plantar flexion, release for dorsiflexion, invert the toe and evert the toe. Okay, good. Did you have any pain in any body part that we went through?
No.
Okay, good. No pain noted. I did not know any popping or crepitation in any part that I assessed. And so full range of motion, which is good. Okay. We're not popping or crepitation. Crepit is noted. Now I'm going to go ahead and move on to some cerebellar chest. So I'm going to have you walk heel toe for me. Yes. Okay, now backwards. Okay, good. Patient is able to, has a steady gait, is able to walk, and has steady forward leg movement. Okay, now I'm going to do a Romberg test. So just close your eyes and try to remain as still as possible. Okay, and I'll do this about 20 seconds, and 20 seconds is up. All right, you had a negative Romberg test, which is good because we don't want a positive one. There was maybe slight swaying, but that's a normal finding, so that's good. Okay, now I'm going to have you close your eyes for me. Okay, and for strongness, I'm going to have you hold out your hand and identify this object for me.
A key.
Okay, good. The patient is able to correctly identify objects and senses are intact. Okay, and stick out your hand for me again. For graphesthesia, I'm going to draw something in your hand and just correctly identify whatever it is.
Number 8.
Good. That is correct. And again, patient is able to correctly identify objects and senses are good and intact. I'm going to go ahead and do your deep tendon reflexes. So, oops. Right. I'm going to start with your triceps. So, I'm just going to have you relax your arm for me. Okay, good. All right. 2 plus. Oops. Relax. 2 plus. Okay, now your brachial. 2 plus. 2 plus. All right, now your patellar. I'm going to do that again. 2 plus. 2 plus. Okay, your Achilles. 2 plus. Good, 2 plus. Okay, all your reflexes were 2 plus. I'm going to go ahead and check my list because I think that completes everything, but I just want to make sure I haven't missed anything.
You were online.
All right, real quick, I'm going to have you shrug your shoulders against my pressure. Okay, good. And turn your head against the pressure. Okay, good. Cranial nerve 11 is intact. And now I'm going to do a rougher alternating move. So just touch your palms and thighs really fast. Okay, good. Patient has good coordination, is able to complete the task properly. So do you have any questions?
None.
Okay, good. Have a good day.
Thank you.